Hello friends, this is Samarth and welcome to my YouTube channel that is Love for Anatomy. And today we are going to discuss about a very important topic, that is the popliteal fossa. But before we start with this topic, I will request you guys to please take a look at my previous videos as well. Now let us get started with the popliteal fossa. The popliteal fossa is a shallow diamond-shaped depression behind the knee joint and at the lower part of the femur and upper part of tibia. So it is a diamond-shaped depression present behind the knee joint. The popliteal fossa is homologous to the cubital fossa present on the elbow joint. Now let us talk about the boundaries of the popliteal fossa. Since it is diamond-shaped, it should have 4 boundaries. And those 4 boundaries are the superolateral boundary, the inferiolateral boundary, the superomedial boundary, and finally the inferiomedial boundary. The superolateral boundary is formed of the biceps femoris muscle. Now this diagram represents the boundaries of the right popliteal fossa, in which this is the superolateral boundary, this is the inferiolateral boundary, this is the inferiomedial, and finally this is the superomedial boundary. Therefore, the superolateral boundary, that is this one, is formed of a muscle known as the biceps femoris. Superolateral boundary formed by biceps femoris. The inferiolateral boundary is formed of the lateral head of the gastrocnemius muscle, and the inferiolateral boundary is supplemented by the plantaris muscle. In this diagram, you guys could easily see that the inferiolateral boundary is formed of 2 muscles, that is the lateral head of the gastrocnemius, and the inferiolateral boundary is also supplemented by another muscle, that is the plantaris. The superomedial boundary is formed of 2 muscles, that are the semitendinosus and semimembranosus, that is this one. There are many muscles which supplement the superomedial boundary, and those are gracialis, sartorius, and the adductor magnus muscles. The superomedial border is formed of semitendinosus and the semimembranosus, that is this is the semitendinosus muscle and these two are the semimembranosus muscles. The superomedial border is also supplemented by 3 muscles, that is the gracialis, sartorius, and the adductor magnus muscles. The inferiomedial border is formed of the medial head of the gastrocnemius muscle. In this diagram, you guys could easily see that the inferiomedial border is formed of the medial head of the gastrocnemius muscle. Let's review the boundaries once more. This diamond-shaped depression is the popliteal fossa, and these are the 4 boundaries it has. This is the superolateral boundary composed of biceps femoris. This is the inferiolateral boundary formed of lateral head of gastrocnemius and supplemented by the plantaris muscle. This right here is the superomedial boundary formed of the semitendinosus, that is this one, and this is the semimembranosus muscle. It is supplemented by 3 muscles, that are the gracialis, sartorius, and the adductor magnus muscles. And this right here is the inferiomedial border formed of the medial head of the gastrocnemius muscle. Now let us talk about the roof and the floor of the popliteal fossa. The roof of the popliteal fossa is composed of, first is the skin, then is the superficial fascia, and next is the popliteal fascia. The superficial fascia has many structures embedded in it. First we have a vein, that is the small saphenous vein, which drains into the great saphenous vein. Next we have 3 cutaneous nerve innervations on the skin over the popliteal fossa, that are the posterior cutaneous nerve of the thigh, the peroneal or the sural communicating nerve. Next we have the posterior division of the medial cutaneous nerve of the thigh. Now let us see the structures in the roof of the popliteal fossa using a diagram. We could see a vein and 3 cutaneous nerves. The vein is the small saphenous vein. This nerve is the peroneal or the sural communicating nerve. This right here is the posterior cutaneous nerve of the thigh. As you guys could see, some part of the posterior cutaneous nerve of the thigh lies as a content of the popliteal fossa. And finally we have the posterior division of the medial cutaneous nerve of the thigh, that is this one. So concluding the roof, we have skin, superficial fascia, the popliteal fascia, and the structures embedded in the superficial fascia. Now let us talk about the floor of the popliteal fossa. The floor of the popliteal fossa is formed of three structures situated above downwards. So the structures of the floor are the popliteal surface of the femur bone. Next we have the capsule of the knee joint along with the oblique popliteal ligament. And finally we have the strong popliteal fascia which is covering the popliteus muscle. One thing to remember is the floor of the poplitea is formed from above downwards. That is, this is present above and these rest structure belong downwards. Now let us talk about the contents of the popliteal fossa. The content of the popliteal fossa has 8 different structures. We have artery, vein, many nerves, lymph nodes, and also the fat. Now let us start with the contents of the popliteal fossa. First, we have the popliteal artery and its branches. This is a diagram representing the arrangement of main nerves and vessels in the popliteal fossa. And you guys could easily see that the popliteal artery is situated in the deepermost part, that is this one. In the popliteal fossa, the popliteal artery gives many branches, that is the superior lateral genicular artery, the superior medial genicular artery, and there is also a middle genicular artery. Then we have the inferior lateral genicular artery, and finally we have the inferior medial genicular artery. Next we have the popliteal vein. This right here is the popliteal vein. The popliteal vein is superficial to the popliteal artery. Next we have the tibial nerve and its branches. I have represented the popliteal artery with A, the popliteal artery with the alphabet V, and finally the tibial nerve with the alphabet N. This right here is the tibial nerve. It is superficial to the popliteal vein as well as the popliteal artery. The next content is the common peroneal nerve and its respective branches. This right here is the common peroneal nerve. It has many branches. The first branch supplies to the short head of the biceps femoris. The second branch is the superior lateral genicular nerve. The next branch is the lateral cutaneous nerve of the calf. Next we have the inferior lateral genicular nerve. All these are the branches of the common peroneal nerve, which itself is the content of the popliteal fossa. Now this branch right here, which is the sural communicating branch, is the content of the roof of the popliteal fossa. As you guys have seen in this diagram, this right here is the peroneal or the sural communicating nerve, a sub branch of the common peroneal nerve. Next, we have two more nerves that are the posterior cutaneous nerve of the thigh and the genicular branch of the obturator nerve. The word genicular means something relating to the knee joint. That is, this obturator nerve supplies, that is, the genicular branch of the obturator nerve supplies the knee joint. Now let us talk about the posterior cutaneous nerve of the thigh a little bit. In this diagram, you guys could easily see that the posterior cutaneous nerve of the thigh first lies in the popliteal fossa and then pierces the deep fascia and enters into the superficial fascia, and finally becomes the content of the roof of the popliteal fossa. The next content of the popliteal fossa is the popliteal lymph nodes, which are present in the popliteal fossa. And finally we have the fat or the adipose tissue, which surrounds and supports all the structure that I have mentioned above. So all the 8 contents of the popliteal fossa are the popliteal artery, the popliteal vein, tibial nerve and its respective branches, the common peroneal nerve and its branches, the posterior cutaneous nerve of the thigh, the genicular branch of the obturator nerve, the popliteal lymph nodes, and finally the fat or the adipose tissue which surrounds and support all these 7 structures. Now let us talk about a concept about the relative position of the popliteal artery, the popliteal vein and the tibial nerve, represented by alphabets A, V and N respectively. In this diagram, I have divided the popliteal fossa into 3 parts, that is upper, middle and the lower part. The arrangement of the artery, vein and the nerve in the upper part from the medial to the lateral side is A, V, N, that is popliteal artery, then popliteal vein and finally the tibial nerve. Similarly, in the middle part of the popliteal fossa, the arrangement from the medial side to the lateral side becomes nerve, vein and finally the artery. And finally, on the lower part of the popliteal fossa, we have nerve, vein and artery, similar to the middle part. The AVN or the artery, vein and the nerve, the NVA and the NVA represents the change in relative position of these 3 structures in the upper, middle and the lower parts of the popliteal fossa. So guys, this was all about the popliteal fossa. If you found this video interesting and informative, please do like, share and please do subscribe my channel. Thanking you, signing off, love for anatomy.